Dozens of states shifting their coronavirus approach, at least 13 lifting stay-at-home orders and reopening business in phases. But infection counts keep climbing.
There are regions that can reopen sooner because they are low prevalence, but no region should open without the testing capacity ramped up so they can do the testing and the tracing required to reopen.
The White House suggests before states even enter a phase 1 reopening, they need to see 14 days of a downward trajectory in case counts, including for influenza-like illnesses. But in states like Florida, Texas, and Georgia, that's not happening, even as they ease restrictions. The New York Times analysis of case counts in those states shows none have logged 14 days of continued slowing. In Texas and Georgia, the 7-day average is on the steady climb.
It's not to say that there aren't parts of Georgia that you could have slowly opened up, but by having the entire state being sort of released from a regulatory apparatus that was keeping people contained, it does raise concerns that it's just going to start spreading again.
The president has slammed tight restrictions, including ones in line with guidance from his own task force. He's pushing for phased reopening.
Well, I think most of the numbers are coming down. We're on the right side of it, but we want to keep it that way. But we also want to get back to work. The people want to get back to work.
Experts say effective restarts rely on testing.
A lot of people misunderstand this issue about testing. I think people think testing is all about diagnosing people so we can treat them. And in this case, that is just not the case. What we want to be doing is finding out that you've been infected before you even have symptoms. And the best way we can do that is by finding you in the community, testing you quickly, and isolating you before you've started to spread.
Data from Apple shows movement is picking back up in states where restrictions are loosening. Those measures coming with requirements for social distancing, face masks, and limits on the number of people in one place.
This is all something that's affecting us as well economically.
Dr. Hala Sabri is an emergency medicine physician in Southern California, east of Los Angeles.
A lot of people have like this pinning idea that if you are for social distancing, you somehow are not affected by the economy demise right now. And that's not true.
California's governor has laid out plans for reopening and is allowing some elective surgeries to resume. But so far, the state's stay-at-home order remains.
I want to say many days, not weeks, as long as we continue to be prudent and thoughtful.
And the more that we have this modified normal, if everybody can get on that, I do think that we can do this safely. I think we can open up the economy and be out in public safely. But I just don't see that happening because people they already don't respect kind of the disease process and the devastation that it's happening because they just don't believe it.
Experts warn without following a phased, data-driven reopening, cases could spike again, potentially meaning an even more devastating economic impact.
From the beginning, the one thing I've said is that the only thing worse than a long shutdown is 2 long shutdowns.
And there are still 1,000 to 2,000 Americans dying every day from COVID-19, even with restrictions in place.
I think that we need to consistently remind ourselves that it's not about me. It's not about my daughter. It's not about my husband. It's about the people who are fighting for their lives in the hospital right now.
James Packard, Newsy, Chicago.